Hi everyone, this is Dr. Binu, consultant obstetrician and laparoscopic gynecologist. Today I would like to tell you all something about gestational diabetes mellitus. So what is gestational diabetes mellitus, or commonly known as GDM? GDM is sometimes even a non-diabetic woman can get diabetes in pregnancy. This happens generally around 5th to 6th month in pregnancy. So your gynecologist screens you at around 24 weeks to rule out GDM by giving 75 to 100 gram glucose, and they do a glucose tolerance test. So when the value is high, generally that means the woman is going to get GDM. So who are the women who are at risk of developing GDM? Generally a woman who are obese, or those with family history of diabetes, and most importantly those who have polycystic ovaries. They are the ones who are prone to get GDM. So from initial stages itself you can prevent getting GDM in pregnancy. And how do you do that? By taking small frequent meals. So instead of taking a 3 times meals and making your stomach full, you can take a 6 times smaller meals, which will prevent the blood sugars from increasing all of a sudden. And secondly, try avoiding refined sugars like maida, direct sweets, sugars, chocolate, biscuits. So, and even white rice, take in moderation. So these steps will prevent the blood sugars from increasing all of a sudden. Also, by doing a moderate walking or exercise daily for 20 to 30 minutes can prevent you from getting GDM. And if you by chance get a GDM, rather than getting your blood sugar tested on and off by going to lab, buy a glucometer yourself at home and do check the blood sugar at home, because there is certain target value which has to be achieved during pregnancy for a GDM woman, which is less than 90 during fasting and less than 140 during 1 hour postprandial, and less than 120 2-hour postprandial. So this is a target value which is set, and there is tight glycemic control which is expected for a GDM woman. Why? Because if the blood sugars are not in control, the baby which is growing inside the uterus can have certain side effects, like the baby's size generally becomes very big and they go into macrosomia, which in turn, and polyamnios, which can in turn cause preterm labor or a higher incidence of cesarean section, and even in normal delivery shoulder dystocias can happen. And most important risk factor is sudden intrauterine death of your fetus, which can happen in the last 1 month. So that is why a tight glycemic control is very much expected. So in the treatment of GDM, how do you treat a gestational diabetes mellitus? First and most important step is walking, aerobic exercises for 20 to 30 minutes. Second is diet control. As I said, avoid taking refined sugars and take complex carbohydrates and more of protein-rich diet. Third is your doctor will add you on OHAs, which is oral hypoglycemic drugs. Nowadays it's proven beyond doubt that OHAs is safe during pregnancy, not like previous times where the doctor directly adds the insulin, because insulin is the next step. If the blood sugars are not getting controlled by OHAs, only then the insulin is added. So these are the medicines generally we start for GDM. So if you take care, generally the GDM can be well handled and you can get rid of GDM. You may not get this problem at all in pregnancy if you are a bit conscious. Thank you.